Yes, hello. Thank you for joining us. This is great. Welcome, families, and welcome to our wonderful panel speakers, Dr. Barbara Sattler, Dr. Jennifer Riegle, and Mr. Tim Dye. Thank you for joining us here today. My name is Nichole Warwick, and I am the co-founding executive director of FAAN, Families Advocating for Chemical and Toxic Safety. And it is my privilege to be here as a weaver of context, facilitating this webinar and sharing information and resources on children's environmental health. Families Advocating for Chemical and Toxic Safety, also known as FAAN, is a clearinghouse for evidence-based expert resources in children's environmental health. We promote easy, affordable, and sustainable actions to remediate harmful exposures to toxics and chemicals in our everyday lives. Our mission is to help families get the facts, take action, and live a toxics-free life. FAAN is a project of the Center for Environmental Health. FAAN wishes to thank you for joining us for this webinar, Smoke and Ash, Air Quality and Children's Health, featuring Dr. Barbara Sattler, Dr. Jen Riegle, and Mr. Tim Dye. This webinar kicks off a series of seasonal webinars focused on children's environmental health and is made possible by generous support from Jonas Children's Environmental Health Fund. In this webinar, we're focusing on children's health and the impacts of air pollution related to what we in California are now calling fire season. California is experiencing another historic year for wildfires. Since the beginning of the year, there have been over 8,700 wildfires that have burned well over 4 million acres in California. These wildfires are responsible for the destruction of homes and our built environments, the displacement of residents, and too many lives lost. The resulting wildfire smoke covered much of the state, resulting in unhealthy air that impacted millions across California and beyond. This wildfire smoke contains air pollutants that impact health. Those most vulnerable to the health impacts of wildfire smoke include children, older adults, people with chronic health conditions, outdoor workers, and first responders. FAAN families have expressed concerns and many questions about air quality in their family's health. So we've convened experts in air quality monitoring, public health and nursing, and naturopathic medicine to address these concerns and help answer some of these questions. In the next hour, we will learn about air quality monitoring, children's environmental health risks and considerations from a public health and nursing perspective, and naturopathic practices that we can do to support our family's health during times of exposure. Each of our presenters will speak, and then we'll take questions from our FAAN families. If you have any questions during the webinar, please share them in the question and answer box and we'll address them. And if you're watching this via Facebook Live, you can post those in the chat and our team's ready to receive those questions. So before we jump into the content, I want to acknowledge our speakers, not only for taking the time to be here with us, for preparing for this webinar and for sharing your wisdom, but especially because we all live in Northern California and we've been impacted over the past several months by fires, evacuations, smoke, and extraordinary stress, not to mention the baseline stress related to the pandemic. So as professionals in your field, I recognize that a 10-minute presentation just scratches the surface of your knowledge about these subjects and what you can share. And it can be really challenging to distill down years of research and practice into a short presentation. I just want to acknowledge you and thank you for doing so, especially considering the stress that families are under right now. It's challenging for families to give a long, concentrated amount of time for much of anything these days with all that we're navigating. So being able to learn the essentials of an environmental health issue and what we can do about it is very empowering. And I want to thank you for sharing your wisdom with us. As we progress through the webinar, I'll introduce each of our speakers in greater detail. But for now, I introduce you to the leaders who I turn to when I have questions about health and the environment. These are my confidants and advisors, and I am honored to introduce them and welcome them to be here with us. Dr. Barbara Sattler, you give us a wave so we can know who you are, thanks. Dr. Jen Riegle, and Tim Dye. Thank you so, so much. I'm deeply grateful. So first, we're gonna learn about air quality and monitoring from Tim Dye. Tim has a Master of Science and a Bachelor of Science in Meteorology. He's a certified consulting meteorologist. He has over 29 years of experience in air quality monitoring, data management, public communication. He's really a visionary, an entrepreneur. He has created air quality and applications both domestically and internationally that monitor and vividly communicate air quality conditions. He's a widely recognized leader in air quality sensor technologies for environmental applications. And what I respect, I think he's also lifted up for, is being respected as an independent voice in the air sensor community. He works in the many areas of air quality, including low-cost air quality sensor evaluation and deployment, air quality monitoring, data management and analytics, insights on air sensing, and citizen and community science applications. He offers a unique blend of strong technical skills, in-depth knowledge, and creativity in developing his innovative and long-term solutions related to air quality. He's regularly sought out for his wisdom, and I am tremendously grateful that he's joining us this evening. Without further ado, Tim, please take it away.
Great, thanks, Nichole. It's great to be here and to talk about a couple of things. One is some of the smoky skies that we've experienced over the last couple of months, but also air quality monitoring, because it's changing. And it's changing actually in a good way. And I'd like to describe that. Let me see if I can get, there we go. But before I do that, just a little bit about me. So that's me, not now, but that was me in high school. And I was making backyard measurements of rainfall. And what I realized was, growing up in New Jersey, is that there's really hyper-local or local variation in rainfall. But there's also local variation in air quality and every other environmental parameter. And this led me on a career, a 30-year career of monitoring air quality, monitoring weather, and really trying to make sense of data. I have my own company where I do a lot of data deployments and advise different groups on how to monitor for air quality and how to turn good data into information. I work with Environmental Protection Agency, but also companies like Intel and Environmental Defense Fund and Bloomberg Philanthropies, a lot of different groups that are very interested in trying to improve our environment and improve it in a way through science. So what I want to do is I want to get you kind of up to speed, quick overview on monitoring, and then I want to bring it down locally to Sonoma County, and then I want to increase and largen up to the world. So first of all, the way we traditionally measure air quality, it's changing. All the way over on the left, you'll see reference instruments. These are really expensive, very accurate instruments that are run by agencies like the Bay Area Air Quality Management District or the California Air Resources Board, but they're run by professionals. And since they're very expensive, one instrument can cost like $20,000. So that shelter you see there, that little trailer, that's probably a couple $100,000. So you can imagine what happens. There's not one of these on every block. And that leads to a problem because we don't know what's going on at a local level. As we move to the right, we go down in cost, and the accuracy still stays relatively high. We have some portable instruments, but it still requires experts to run those. What I'm most excited about is this emergence of air sensors. Some people call these low-cost sensors, backyard air sensors, a lot of different names. The bottom line is these are a lot cheaper. You can go on Amazon, you can buy them. You can deploy them in your home, backyard, neighborhood. And what it does is kind of like me back in New Jersey, making measurements of rainfall, you can see what's going on in your neighborhood now. Okay, now there's a couple issues here. One is you'll see that accuracy bar. It says varies. There's some of these that work surprisingly well and very good. Other air sensors out there are horrible. They're totally inaccurate and don't work. So it's a bit of a challenge. This is a new technology that's really been emerging over the last decade or so, and it's starting to increase. And we're realizing that some of them can be really useful for detecting things like smoke. And I'm going to show you some examples. But one of the things I wanted to do is to kind of get everyone up to speed just quickly. The principal component in smoke is what we call particulate matter, PM 2.5. These are very small particles. They're solid and liquid. That's what you see when you see the smoke in the air. You're seeing all the particles, okay? There's larger particles, PM10 and sand and things like that. A lot of those large particles get caught in our throat. We don't inhale them into our lungs. But the PM 2.5, that can enter into our lungs and even the cardiovascular system and cause issues that the other speakers can certainly talk about. When it comes to measuring air quality, it is changing, and there are a number of really good things. And I often like to come back to some of these quotes. In God we trust, all others must bring data. And data can really tell you a lot what's going on. I also like the quote by Peter Drucker, you can't manage what you don't measure. And I always like my quote down at the bottom. It's fun to measure the world that we're living in. If we have a device that can tell us, here's something that's unknown about what's going on, what a wonderful way to kind of discover the world and figure things out. This is a map showing hourly concentrations color-coded to the air quality index for particulate matter, okay, principal component in smoke. These are all the government-run stations. These are all the very expensive sites that are located in California. On this particular day, everything was pretty good, so that was probably not one of the fire episodes. But then what I did was, one of the things that the Environmental Protection Agency is doing is they realized last year with all the smoke episode that a lot of people have deployed air sensors out there. And one popular one is called Purple Air. And it costs about $250. And the city I'm in is Petaluma, and there's probably about 20 of them scattered around. So the Environmental Protection Agency is doing a pilot project where they're bringing in the Purple Air data, and they're actually making it better. And I'll show you that in this, this site right here, or this slide right here. So the triangles are portable sites that are deployed by the Forest Service, color-coded to the air quality index. The circles are the expensive government stations. So if you can see in our area, we have a government station at Napa, San Rafael, and out at Sebastopol. Those are the only three kind of official government stations. But look at all these low-cost sensors. These are operated by citizens, by community groups, by schools, by a whole bunch of different groups. And look at, on this particular day, and this is the glass fire, the smoke plume was going down through kind of southwest Santa Rosa, north of Petaluma, and then down over Point Reyes. It was really missed by the government monitors. But if we look at these low-cost sensors that are run by a citizen network, it captures that really well and shows that there were unhealthy levels and unhealthy for sensitive groups levels that were undetected by the government monitors. So this shows kind of the value of blending together government data, citizen collected data. It's a wonderful kind of co-creative thing that's going on right now. And I think we're gonna see more and more of this. There it's showing the government stations, all three of them. And you can see that that plume on that particular day and that hour missed it. Now, air quality moves around with the wind, so it may increase and move over one of the reference stations and it'll detect it, but on this particular time and day it didn't. So it shows the value of this new sensing technology. And this is just a close-up, but you can see, look at all these monitors here, and these are run by everyday people that just buy them and put them out in their particular neighborhood. Um, I want to broaden up a little bit to the world because I think it is important to recognize that our situation here in Northern California with fires is really bad. But there's an entire, 7 billion of us on the planet, and there's a lot of people that live in really poor air quality. And I took an air sensor, which I'll show you when I come back on camera at the end of the presentation. I'll show you. I took one of these into New Delhi about a year ago, this time of year. And what happens in New Delhi is a lot of the farmers burn the fields and create a lot of smoke. And, it was a big kind of national emergency in the air, and it had all these articles, front page and so forth. What I did with this air sensor was kind of interesting because I could carry it around with me. So I made air measurements, not outside, I made air sensor measurements in my hotel room. And these, working from the left over here all the way to the right. So this red area all the way over on the left is in my hotel room. That's with an air purifier. So that's a level that we actually experienced during the wildfires here in Sonoma County. I walked outside, levels were 3 to 4 times higher outside. I walked then back into my room and then back outside again, and levels were really high. So I think, one of the things to realize, I think when we do have unhealthy air, it's bad for us, but there are a lot of people in the world, and it's kind of sobering for me working in air pollution, that live in these conditions and can't escape to a room that has an air purifier, can't go indoors. They live and work outside and breathe these conditions, and it leads to enormous health burdens that many researchers are studying. I want to bring it back locally to Petaluma. One of the things that we did, and here's a picture of the air sensor in the lower left. One of the projects that I did was to work with high school students to hand them a sensor and to teach them a little bit about air pollution and then see what they would do with that air sensor. And it's kind of interesting what they did. They started walking around and they discovered that there were high carbon monoxide levels in the men's locker room. And that was due to a somewhat malfunctioning boiler that was creating high CO levels. And then they brought it in the classroom and figured out that there was high carbon dioxide, which we respirate. And when it gets real high, then students kind of get groggy. And this is obviously before the lockdown and before COVID really took hold of things. But the end result is, these devices, when carried around or when placed in your backyard, can be used by a variety of different organizations if the data quality is good and sufficient. So that's kind of a quick overview of what's going on. I'm happy to answer any questions about this, when we get to the discussion period. But a couple questions I had for you is, would you buy one of these air sensors? I'm kind of curious about that. And how would you use this information? What would you do with it? And what decisions would you want to make with the information? And so I'm kind of curious about, if you have any ideas about that, I'd love to hear what you're thinking. And then let me stop presenting. And I just want to show you, this is the air sensor. So you can hold it in your hand. It measures particulate matter, carbon dioxide and carbon dioxide, temperature and humidity. Here's another type, like this right here you can hold, or I had another one, maybe it's over there. They come in all different shapes and sizes. Some of the data quality is not so good. So there's a number of websites out there that kind of rank things and tell you what's good. But let me stop there and pass it on to the other speakers, and then we can have questions.
Thank you so much. That's so informative and encouraging to learn how empowering that citizen science is.
Yeah, it's great.
Yeah. To speak next, we have Barbara Sattler. She's a registered nurse. She has a master's and a doctor in public health. She's a fellow of the American Academy of Nursing. I'm honored to call her a friend. She works as professor emeritus at the University of San Francisco and is an international leader in environmental health and nursing. She's a founding and active member of the Alliance of Nurses for Healthy Environments, an international organization that's helping to integrate environmental health, including climate change, into nursing education. practice, research, and policy advocacy. Dr. Sattler has been an advisor to the US EPA's Office of Child Health Protection and the National Library of Medicine for informational needs of health professionals on environmental health. She received her Master's of Public Health and Doctor of Public Health from Johns Hopkins School of Public Health. She lives just down the road from me in Sonoma County on an organic farm with her husband, dogs, and chickens. It is my great honor to present Dr. Sattler. Thank you.
Thank you so much. Let me get myself organized here. Hang on just one second.
Not a problem.
And it is indeed an honor to do anything with my friend Nichole, and I'm happy and honored also to be with Tim and with Jen today. And I have already learned much from Tim, and I look forward to hearing Jen's her presentation as well. So we're given this little bit of time, so I'm hoping that this will be cogent and that maybe there'll be one or two gems that people will pick up from it. So wildfire smoke, while clearly a part of it, a big part of it is particulate matter, there are also gases involved in what comes from the fires. And the particulate matter, as Tim noted, depending on its size, may wind up depositing in the upper airways, in the nasal area. But the gases are in a form, VOC stands for volatile organic compounds. These are chemicals that are can be gaseous at room temperature. And those actually can go right across into the lungs. So they go right down into the lungs and can pass into and become part of the systemic toxicants that we wind up having in our body. So what is burning in a wildfire? Well, if we're just talking about a forest fire, you've got perhaps a little bit of a limited number of things. And by that, I mean, it's still a lot of different things. But then you start adding homes and barns and industries and stores like Walmart's. Now you are burning everything. So in addition to burning forests, you're burning plastics and metals and pesticides and solvents and a huge litany of things. And what's really important, I think, for us all to understand is that we have a limited amount of knowledge that's been created by what are sometimes called combustion scientists. These are scientists who actually will burn things, burn various compounds to see what gets created. And there are a lot of things that go into that. So how high are the temperatures? So for instance, we know that when we are making polyvinyl chloride plastic, PVC plastic, that during that process, dioxins are released. There are pollutants that come out the smokestack. We also know when we burn PVC plastics, dioxins and furans are released, as long as the temperatures are high enough. And dioxins and furans are a family, two families of chemicals that are some of the most carcinogenic chemicals known to man. We know that dioxins and furans sometimes wind up naturally occurring in forest fires, but we also know that there's a lot of PVC plastic in people's homes. Those white fences that are made out of plastic, that's PVC plastic. So I want people to understand that what we know about combustion science vis-a-vis wildfires could fit into a very small thimble. That we have a lot of research yet to be done on really what is it that's winding up in the air and by extension in some of our bodies. So when we think about the population and their exposure from smoke and from the gases and particulate matter, there are a couple of things that are going to make a difference. One is how big is the area? the Trinity Alps area that was on fire up north here burned over 1 million acres in just one big complex there, the August complex. That's a huge amount of smoke that's going to go out. It also depends on the fire intensity, and all of you probably remember in 2017, the fires that we had in Sonoma County there were made a lot hotter because we had extreme wind that was, you know, kind of super moving the oxygen into the fires and really created incredible intensity. And the rate at which things are burning. Also dispersion. So lots of dispersion models have been created to show where the plumes are going. And then where is the population? You can see on the bottom here, the population is right up against the fire. What we've discovered is that very often wildfire smoke is more toxic than urban pollution is. And there's just a lot more that we're learning. Acute symptoms that people, and all 4 of us that are on this call here presenting, know that people get acute symptoms: cough, trouble breathing, sore throat, runny nose, irritated sinuses, headache. My husband, who has a history of oral cancer, he feels changes in his tongue as soon as we have some smoky days. People experience the smoke in a variety of ways. I also want to note quickly that this smoke, this particulate matter, comes down to earth. And I know that the people on this call, as it were, have probably experienced this in their house and their outdoor horizontal surfaces, that the ash came down almost like it was snowing after these last fires. And these are the biggest particles. These are the visible particles. The smaller the particles, the more easily they become re-airborne. So you could just go with your hand across the top of the table. They're so light, they could then become re-airborne in your home again. And so this becomes part of our house dust, as it were. And I think the important thing to note there is, if we've got these variety of particulate matters at various sizes, and they're part of our house dust, that children are particularly at risk then, because a couple of things. One, they breathe more body weight, they breathe more per body weight than we do as adults. So they're winding up having a greater proportionate impact from bad air, from wildfires. Also, their lungs are still developing till they're about age 12, actually, as well as other organs, including their brain, including their immune system. So those chemicals that are also part of these small particles, these PM 2.5 and smaller, these can affect a variety of organ systems, and because children are still developing those, they're more vulnerable. They also, and this is a normal part of growth and development, they do a lot of hand-to-mouth activities in exploring the world. And if we haven't been extremely good with our house hygiene, this is a way that they could get some of these particulate matters into their body. And they spend more time on the ground, which of course means that they're on this great big giant horizontal surface. So we also know, and I should quickly say that a lot of the studies have been done in vitro, meaning that they were done with cells as opposed to a whole human, because we don't intentionally expose people to smoke or toxic chemicals. And more recently, we're beginning to do epidemiological studies. I'll talk about that in a second. But a lot of the studies that have been done to date around smoke and exposures shows us that increased inflammatory processes happen with the lungs, and cell damage to the actual cells within the lungs. In addition, once again, using in vitro studies, exposing them to the kinds of particulate matter in fires that are wildfires, there are chemicals that will suppress the immune system. So Tim did a good explanation of this. I don't feel like I have to go over that, but I should say that if you look at the different categories here, once you start looking at the ultrafine particles, these are the ones that, that wind up being absorbed systemically. So the chemicals that are trafficked into our bodies through these fine particles will have the same effects that they have if we ingest them and they get into our systems that way, or if they go through our skin and they get into our systems that way. Really important to understand that. We know that we've been doing a kind of sort of better job with managing our air pollution in the United States, and we've been seeing a decrease in PM2 levels nationally. However, we're now seeing an increase in the Western states because of the particulate matter from fires and the mere extent of the fires that we have. And in some studies where they've been modeling these fires, they predict that towards the latter part of the 20th century, we'll see as much as double the premature deaths. And another thing that I just would like you to think about, which is the estimates for the damage created by fires, not just the individual homes and the incredible disaster that is to an individual family, but also the infrastructures that are destroyed and the schools and libraries and hospitals and facilities that for power and water and sewage. I mean, all of these infrastructures, they are estimated at a cost of $11 to $20 billion, depending on who you're looking at. And the reason I have this particular pie here is because we only have one pie of a federal budget, one pie of a state budget. And if we have to continue to cut out big slices of those pies to take care of the damages associated with our fires, then what that means is that we've got less of the pie for schools and social services and good public transportation, mental health. I mean, the whole laundry list of the things that we know are really important to health and well-being. So I hope that this just gave you another little sort of picture of the big puzzle that we're trying to paint here. And with that, I'll stop sharing and I'll be happy to answer questions when we are done. And thank you so much for having me. I really appreciate it.
Thank you so much for that, Barb. Wow, I'm resonating with all the context that's being set, how we measure air quality in our communities and how we interpret the science around that and how it impacts us and our health. It's very important to understand the environmental health risks associated with wildfire smoke exposures. And then the variables therein, like just wildfire and then wildfire that includes urban and built structures. I'm imagining a lot of people are wondering, like I am, well, okay, that's all of the science and the information. We know how it impacts us, but what do we do about it? Which is one of the reasons why I invited Dr. Jennifer Riegle to join us today. Dr. Jen Riegle is a licensed naturopathic doctor. She has a degree from Bastyr University, which is one of the leading institutions in natural medical care and research. And she carries advanced certification and training in women's health, infertility, biofeedback, and traditional medicine practices. She and her husband, Dr. Chris Holder, own and practice medicine together at Wild Oak Medicine in Santa Rosa, California. Dr. Riegle is also the co-founder and co-executive director for the nonprofit Integrative Healers Action Network. Integrative Healers Action Network is a disaster response organization that offers trauma-informed integrative healthcare for first responders and underserved communities impacted by disasters. In fact, that's how I came to know Jen. I've had the great pleasure to collaborate with her on the Sonoma County Environmental Health Coalition, bringing some of this work to the communities and our most vulnerable populations here in Sonoma County, particularly after the 2017 fires. Little did I know then, Jen, that we would be having this conversation again in 2020. And so I'm really curious what we can learn from you. Now I'm gonna pull up your slideshow.
Perfect. And while you do that, I'll just kind of introduce a little more. One of the biggest things I do in my private practice and that we do here is treat patients with environmental medicine issues and have been impacted by toxicants in their health. And it's becoming one of the bigger things that I do at the nonprofit as well, doing a lot of environmental health education and treatment for first responders and communities impacted by disaster. So it's a really big passion of mine, and I'm grateful to be here today. I learned so much already. It was so great listening and just gathering wisdom and tools from Tim and Barbara, so I really appreciate that. And I actually have a couple of questions for our Q&A at the end for Tim and Barbara. So I'm excited about that. Go ahead. So I knew, because of what I do and because I've had this conversation a lot of times, that as we're focusing on children today, that we know without a shadow of a doubt that children are one of our most vulnerable populations for smoke inhalation and wildfire damage. So what I wanted to kind of balance that and remind you of is something that I just see a lot in practice and that we see a lot in pediatrics, which is that, yes, we do need to be concerned about this for children. We definitely know that. And I know as a parent that a lot of times hearing that information can be really scary. And I want to also encourage you that if your children's had this exposure and you haven't been able to manage it in the way that you've wanted, that I also see a lot that children are very resilient, especially when you give them just a little bit of support. It goes much further in children than it does in adults. And so, you know, just knowing that there are some things that you can do about it to help support their bodies, and that we can learn about how to prevent more in the future. Rest easy, and also know that if you have a child who's experiencing a lot of difficulty post fire exposure, smoke exposure, definitely reach out to their doctor. A lot of NDs or functional medicine doctors can treat kiddos who are having more of the severe complications. Next slide. Thanks, Nichole. Okay, so anyone who does environmental medicine will tell you that the first rule of environmental medicine is to reduce as much exposure as possible. We don't want to have to clean up, you know, toxins that are in the body if we don't have to. And so reduction of exposure is the biggest thing. We cannot reduce all exposures to all chemicals and particulates in our life. We just can't. And so that's where some of the health things that I'm going to talk about here and things that we can do to boost our health come in handy. But I want to go through this piece first. And I want to just mention that there's a lot of things. I have this presentation targeted towards children. And there's a lot of things that I would do for adults that I wouldn't do in kiddos. And so this will be targeted towards kids. And if I have a moment, I will try and just make comments about where I would do things differently for adults, but I'm going to focus mostly on kids. So loved, I don't think I need to belabor this at all because Tim did an awesome job with this. Watch for air quality updates. And so I loved learning more about that. That was such an education for me about the differences there. My rule for my family and for my patients when I'm educating them is that if it's out of that green zone, if the AQI is over 50, then we stay indoors. And one of the shockers to me was that if we didn't have enough air purifiers running in our home, one, or two, there was any leakage of that air coming in, and I'll explain what I mean in a moment, that the particulate matter amounts in our house based on our meter were really high still. And so I think it's a really good thing to remember that just closing your doors doesn't necessarily mean that your particulate levels are low. And again, really curious again to ask Tim this question, but I noticed on the meters, both on the air quality meter that we own and also on some of the indexes that I would see, that you can't always smell it either. And so that was a trickiness for us to make sure to watch. So I put on here, and this is one of my questions for Tim. I put on here, we have an IQ air meter, and I'm really curious to hear what he thinks about that, if there's one that's better. And so we'll ask him that question at the end. I really recommend measuring your inside air quality with some sort of a meter, so that it gives a lot of power and feedback, and it really helped us relax. So when we knew that our inside air quality was in a good place, it made me feel like I had somewhere to escape to. And so it's an empowering tool, and it also helped us plug leaks. So we just moved into a new home in July, and just kind of getting to know things a little bit. And our system, the way that it was set, it was pretty unclear which settings in our air system would be bringing air in from the outside at all, and which ones wouldn't. And so in our home, that was the case, and we were able to figure that out based on some trial and error with our air quality meters. And in our office, we actually turned off the air, and our air quality was not getting any better. It was so insane. So we were trying to figure out what was going on, and we realized that even though the air was off, there was still air being actually pushed through our vents. We could feel it coming through when we got up there really close. We covered them with a plastic bag and tape, and immediately our air quality got better with our filters running. So it can just help to do that. I have no affiliation with this company at all. It's just, I like people to know which brands have worked for me. And so there are a lot of them out there. I really recommend getting an air purifier that is both HEPA and carbon. It helps to take care of those PM 2.5s as well as some of the VOCs in the air. And so that's why I recommend that to patients. And it's what we do in my house as well. So we run air purifiers in every room. And again, if you have an air quality meter, you can make sure that whatever you're running is adequate. If you don't, you can actually check, and each air purifier should tell you how big of a space that they're rated for. So if you can measure inside of your spaces, it'll tell you, this is good for 300 square feet, for example. And then when you go outside, if your child is old enough, have them wear a HEPA plus carbon filter mask. And so I like those ones that have HEPA and carbon filtering for the same reason as I talked about for the filtration systems, air systems. And trust me, parents, I know that it's really hard when your kiddo is going nuts because they want to go outside. But it really is damaging to go out in really poor air quality. And so I just encourage you as much as you can to keep them inside in a clean environment when the air quality is really poor outside, and keep them engaged in other ways as much as possible. Go ahead, Nichole. So dietary changes, the big picture here, and you can come back, this is going to be posted, I believe, and really read through and write down anything that you need to from here. But so for kiddos, lots of fruits and veggies. We want the rainbow, and a lot of these foods are going to have compounds in them that are great for squelching oxidative damage. And so that has to do with some of the cellular damage that Barbara was talking about as well. So we want things that have a lot of antioxidants. People have heard mostly about antioxidants when I talk about them. But the reason that you want to eat the rainbow is that each color tends to have different antioxidants and different compounds in it that help with either detoxification or helping to quell oxidative damage or cellular damage in our bodies. I'm going to add in a little bit here today because Nichole had asked me to do that, and I think that is important right now. Some pieces around immune health as well. So you'll see that sprinkled in here too, since we're living in COVID times. Avoiding processed foods and simple sugars that will keep our inflammation down. Avoiding especially sugary beverages. For kids with asthma, if they're having a difficult time, we find a lot of times that really mucus producing substances can make it worse. And maybe they did okay with it before the fires and it's just one more thing. And so we want to take out anything that's mucus producing to help give them that little bit of room to breathe. So cow's milk can be very mucus producing, or cheese, cow's milk products can be really mucus producing for kids and adults actually. Organic whenever possible. You can take a look at the environmental working groups, Dirty Dozen and Clean 15, to get an idea of which ones are the most important for eating organic. And so for immune, just some of my top beyond this advice here is herbs, lots of herbs in your food. So thyme, oregano, garlic, rosemary, etc. Bone broth. You can, if your kiddo doesn't like bone broth, you can make their rice with bone broth, or you can make quinoa with it, or you can make a soup out of it. And then I know this isn't a very popular, and if you have an older kid, mushrooms could be helpful, but I actually don't know many children who prefer to eat mushrooms or who like the texture mostly of them. So try it if you can. And there are some ways that in our house that I like to just sneak greens in. Luckily, we have a pretty vegetable-friendly child, but we came up with like a, actually it started with St. Patrick's Day. We started doing green pancakes, and our green pancakes, you just put your pancake mix in a blender and throw a bunch of spinach in there. You really can't taste the spinach, and it makes really fun, bright green pancakes. Oh, go ahead, Nichole. So for detox for kids, it's a little bit different. We don't push as hard for children, and the things that we can get them to take and taste are a little bit different. Luckily, with most kiddos, their systems are much more resilient as children, and so it doesn't usually take as much as well. One of the top things that we found to quell oxidative damage and smoke inhalation damage is vitamin C. And that's something that most people have access to. Fruit anthocyanins, so you'll see it on the right here. This is one of my favorites. This is a company that I use. They're so tasty, and they're basically, it's a very concentrated fruit liquid. And so that's fun for kids. It tastes great. I call it Mary Poppins medicine. And you can just take a spoonful of it. They'll usually do it like that. And it, again, that helps with the oxidative damage. In older kids, you can give them glutathione. Glutathione is a major antioxidant and detox system in our body, and we can give it from outside to inside. I really only like it in sublingual, nebulized. There are some other compounded forms, but or IV form. For children, you really can only usually get them to do a sublingual sometimes. And I give them much lower doses than adults. We don't want to push quite as hard on their systems. Sometimes we can get them to nebulize that for their lungs, which is what we do for adults usually, but it's got kind of a sulfury taste, so not every child will do that. Make sure that they're drinking enough water, that they're having regular bowel movements, and that they're moving their bodies. So all of these things will continue to help with their detox process as well. Go ahead, Nichole. For immune supplementation, so we saw in Barbara's presentation that one of the impacts of wildfire smoke is a reduction in immune functioning. And so obviously we have our ear tuned to that right now with COVID. So I wanted to give you some options here. Vitamin D, we know vitamin D, very important for working with preventing illness in general, and it's coming out in the research as a leader. It's something that you want to be up to date on and taking enough of or getting enough of for COVID as well. And you can get little drops that really don't taste like anything in most of the cases, so your kids will hopefully take them. You can also get vitamin D in a vitamin D fish oil combination. This can be really helpful for quelling inflammation as well, especially in kids with asthma. Again, vitamin C and zinc. I don't like zinc to be taken for long periods of time at high doses because it will interrupt some absorption and use of other minerals. But over the short term, it's great and can be used maybe when you're more at an increased risk. So if you're traveling or something like that. Sun and fresh air, very important when it's clean. Exercise and moving their bodies as much as you can. Oh, the next one's a tough one. Mitigating stress for kids during COVID and wildfires is hard, and I know that. And so as a parent, you just do your best. And there's a balance somewhere there between, kids like information. A lot of times it calms them down. And there's a balance there of not giving too much information or talking about it too much when they don't ask. And that's a really difficult balance to strike. I get that. And so just know that with the intention of that in your mind, you're doing your very best, and none of us know how to do that perfectly. So there's going to be some stress, and you can help your child learn new coping mechanisms, and also recognize that engaging them in play can be a really helpful way to just take their mind off of it and get their nervous systems back regulated. And then sleep. Sleep is really important. So that is that. I'm excited to ask and answer some questions.
Thank you so much, Jen. Wow, that really helped me to align with understanding not only the complex issues at hand with smoke exposure, but I feel empowered with a sense of agency, like there's some things that I can do to help protect my family and my children. I'm really grateful for all of those tips, and we can share those. Just looking at some of the questions here, but before I jump to our family's questions, Jen, you had a question of Tim, and I want to make space for that.
Yeah. Tim, can I ask you that question? So if you're looking at those, $200 to $300 models, do you have something that you recommend? And how does the meter that I have, and I guess I don't use Purple Air meter myself, but how do those add up?
A couple things here. One, I don't represent any of these. I'm independent, so I want to get that on the table. Some of them work, I think, directionally really well. For example, Purple Air. When particulate matter is going up and smoke is going up, Purple Air goes up. The problem with Purple Air out of the box, it overestimates 50% of the time.
Mm.
So that means like it's going to hit 50 AQI on your scale when it's only 25.
Mm-hmm.
So that's not good. So, the pilot project that I showed, and if you want to get to that, you can go to airnow.gov and look at fire and smoke map, and you can see that kind of blended map with the reference stations and the sensors. But, there are a number of sensors out there. There's a group in Los Angeles, the South Coast Air Quality Management District, has a program called AQ, Air Quality Spec, SPEC. If you Google that, they evaluate these sensors. So the one, people ask me all the time, what's the best sensor I should buy? Well, it kind of depends. Purple Air is a decent one to buy, but just recognize that it overestimates. They're trying to make some changes for that. IQ Air have a couple of those. They're interesting. They're decent. They've performed reasonably well. And there's a number of other companies out there. I think with any device like this, just getting it in and trying to get an understanding of how it changes directionally. When I turn on the air purifier, does it go down? When I open the door, does it go back up? Trying to understand our environment and the changes that we're making or are happening in it, and then these readings, I think is really important. And Jen, I think as you said, sometimes you can't always smell it, and it's surprisingly high. And so that's where these devices come into play. I like having both an indoor one and an outdoor one because it gives me an idea of what's happening inside, and how I can use my air purifier. So.
Awesome. Thank you
Yep.
so much. That's so helpful.
The one other recommendation I would make is that some air purifiers have an ozone generator in them, and they generate ozone to try and get rid of some of the bioaerosols and things like that. We want to avoid those. You're not allowed to sell those in California. And if you go to the California Air Resources Board, you Google California Air Resources Board air purifiers, they have a list of approved air purifiers for the state. And fortunately, we live in California, and it's one of the more environmentally responsible states. And, the air purifier, they have a list of air purifiers that are approved. So.
I so appreciate that. Everything that I put on there as specifics comes from personal experience, the brands and such. And so knowing a broader picture and being able to see a broader picture is really helpful. So appreciate that.
Yeah, these reputable sources like the AQ spec program that I mentioned, California Resources Board with air purifiers, are really good to go to because they're spending millions of dollars, trying to figure out what works and what doesn't and how well they work.
Mm-hmm. Thank you.
Thank you for mentioning that about the ionizers on air purifiers. We had several questions about that. There's a lot of curiosity about like do-it-yourself air purifiers. What do we do when we're dealing with smoke and ash, but it's also high heat days and we're not able to get air circulating through a house? And so I posed that to you guys. What do you do? What do you do on those hot days?
If I'm being honest, I dress down and keep my doors closed. I think that cooling the air can work in some air conditioners that are inside the space can work. Air conditioners have their own problems, and we won't go into that. So I don't usually do it in my own house. But if you're going to use one, make sure. I had a friend that was doing this actually, who was just, not thinking about the fact that it was in her window and it was pulling outdoor air in and not filtering it. And they were like, why is our air filter running full time and we can't get our air quality in good range? As soon as they took that out and replaced it within one that was just sitting in the room, it immediately got better.
I think one thing I've done, and I did this a year ago, this time when I was in Delhi, is there was no escape. I'm in my hotel room and it's at pollution levels that we were experiencing outside. And I decided, well, the one thing I can control is I can reduce my exertion. I don't need to exercise. I don't need to walk a lot. I can actually breathe less. And I know we can't shut off our breathing, but we don't have to go out and exercise. We don't have to go for a walk. It was amazing to me just being in my office, and it looks out over a park, and it, I was looking at the air quality index levels and they were like 150, and someone's out there just doing jumping jacks. And they're breathing in, and their exposure to pollution is really increased because their breathing rate is higher. And so if you can't do anything, well, you can lower your breathing rate by just, not exercising that day or that hour for that period, and trying to, watch a movie, do something like that. It's hard.
And we know that that's true as well. Barbara mentioned it, that increased respirations in children, but we also know that that's true for pregnant women. Their respirations also go up. And so it's another group that is more vulnerable.
I wanted to just share something because this program is a lot for parents and moms in particular. And so I was looking through the literature while I was preparing this little talk. And as I had said before, there weren't a lot of human studies, but I did find a few. And one of them looked at, and most of them don't look at children, but this one looked at adults and children. and their exposures to extreme fires and smoke. And it followed adult males and children for 10 years. And what they found is the adult males continued to have measurable amounts of lung dysfunction, and the children did not. So in terms of children's resiliency and their ability for their body to repair, it's just a piece of something of the research. I don't often read research that shows me something good that's happening. So I was really pleased to read that. And I wanted to share it with folks because you're probably not hearing a lot of good news either.
Thank you so much for sharing that. What a beautiful way to close, to really like lean in and trust our resilience and our children's resilience, and that there are things that we can do to help nourish and support us through these challenging times. I'm tremendously grateful to each of you for just being you and being in the world and showing up the way that you do, but also greatly heartened and feel this sense of satisfaction that we're able to help share out some of your wisdom to families at this time. Thank you so much for joining us this evening. And with that, good evening. Thank you all so much for joining us.
Thank you.
Thank you.
Thank you.
Thank you.